having the forethought to think about who you're selling it to. If it's internally, who are the people that you need to get on your team? It's very important to be able to put them in a position to say yes. And you don't do that without thinking in advance what would make them say no, how much it's going to cost, what support you're going to need. If you're working with vendors, IT departments have so many things to consider. Normal IT departments is stressful enough, but then you put healthcare on top of that, and it's all the regulations and all the acronyms. So it's a ton of stuff to understand in advance before you start your negotiation.
A lot of times the people who are negotiating in behalf of the organization are not really comfortable with it. They see negotiation as conflict. And a lot of people hate conflict. Lynn and I are lawyers. We eat conflict for breakfast. We jumped into that, right? But a lot of people are really uncomfortable with conflict. And so they think that asking for something is taboo. And so I think it's really empowering when you start thinking about, just like Lynn said, if you're wondering, then ask.
Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitarice, and today I'm joined by two very special guests. Maggie Neustadt is the Vice President of Risk Management for BJC Health System, and as an attorney and clinical risk manager, Maggie directs the risk reduction and mitigation strategies for the system's operations across 22 adult, pediatric, and specialty hospitals in Illinois, Missouri, and Kansas. And Lynn Price is a speaker, author, and attorney with over 25 years of experience and over 11,000 successfully negotiated agreements to her credit. She is also the author of the best-selling book, Negotiate It: How to Crush Your Fears, Develop Your Negotiation Muscle, and Gain Power in the Workplace. Welcome to you both. It's a pleasure to have you on the show.
Hi, Chris. Thanks for having us.
Thank you so much.
All right. And today we're going to be talking about one of my favorite topics. And this is both as a business person and as a father to a precocious 5-year-old, negotiation. Before we dive in exploring negotiation tactics, I understand that you met on the first day of law school. So what's the story there, and how did you guys get together?
So the very first day of law school, you come into a class of about 85 people, and they assign you to sit alphabetically. And my last name, Neustadt, was proximate in the alphabet to Price for Lynn. And so through the entire first day, they sat next to each other. Lunchtime came, said, do you have any lunch plans? No. Do you have lunch plans? And the rest is history, as they say. And now we've been in each other's weddings, godchildren to each other's kids, and have been fast friends ever since.
Very cool. And I know, Maggie, you helped proofread Negotiate It, Lynn's book on negotiating tactics. I'm curious, what stood out to you as particularly relevant to the healthcare industry?
Yeah. So Chris, what's interesting about the healthcare industry is people who work in healthcare adjacent support services, I'm going to say, like legal, like healthcare IT, where we are not actual clinicians, but we work in close concert and provide support services to the clinicians. A lot of us get into leadership positions because we're subject matter experts. We're really good at what we do. But as part of that development, we don't ever get any formal training on how to negotiate. People just assume we know how to do it, or they assume that you've done it over your lifetime. We spend a lot of time investing in skills and leaders, but I don't know that we really give people a lot of good training about negotiating, and whether it's negotiating within your own organization or external to your organization. When I was reading Lynn's book, I was thinking about my own teams, and I thought, wow, this is good information that lots of people in healthcare could benefit from. And, we don't have a great platform for that. So I was instantly intrigued by the idea of how we might be able to share this across the healthcare industry.
Yeah, that's really fascinating. And I want to dive a little bit deeper into that. You mentioned kind of internal, external, all the different sort of negotiations that happen in healthcare and sort of otherwise. I think about securing funding and advancing projects. So I'm hoping, Maggie, can you talk a little bit more about the challenges in terms of healthcare leaders and what they face advocating for new initiatives, for example?
Yeah, I think one of the challenges in the healthcare space in particular is how fast everything is changing. And it is so hard to keep up with all the pace of change. I think that's really hard for healthcare leaders, especially when it comes to internal and external contracting. Sometimes I think we worry we don't have leverage because there might be one vendor in this space who's leading a really novel initiative. And so, one of the things that Lynn talks about in her book, and she'll share with us shortly, is when you feel like you don't have any leverage, how you still can negotiate, how you can still try to assert your case even when you don't have any leverage. I think the other thing too is as we're in a environment of mergers and acquisitions, I think there's so much difficulty with healthcare negotiations because you've got maybe separate legacy systems and you're trying to reconcile which one you're going to use. A lot of negotiating going back and forth just within the two or more organizations that may be merging. So you've got these negotiation skills that we need to be able to use internally as you're consolidating potentially a healthcare IT department or offloading a healthcare IT department, as much as we need to have good negotiation skills when we're talking about negotiating with outside vendors. So I see it as an opportunity for us to take on some new skills, both internal to our day-to-day work, as well as with our advocacy that we do in our roles on behalf of our organizations.
That's really interesting. And Lynn, I want to turn to you and start talking about Negotiate It. And by the way, it is a fantastic book. Any book that can bring in Liz Lemon and Jack Donaghy into the conversation is like right at the top of my list. And there's also some really wonderful nuggets in there in terms of negotiation tactics. One of them is the 3 R's of negotiation: be ready, be reasonable, and be relatable. Can you go into a little detail and break those down and explain how they apply to health IT negotiations?
Yeah, of course. So as you mentioned, I've done over 11,000 agreements, and you can't negotiate that volume without picking out some patterns and some consistencies and things that are working well and things that you can implement quickly to get a good negotiation. So that's how I came up with the formula. I also like it twofold because it's easy to remember. You don't need a law degree to remember this formula. It doesn't have to be this complex, beautiful mind thing. It's very easy to remember. And then it's just very successful. So those are the reasons I like it. But in terms of, what it means, the first R is being ready. So that's your due diligence phase. That's, knowing, if it's a project that you're trying to get funded, knowing all about that project, the ins and outs of it, but also having the forethought to think about who you're selling it to. If it's internally, who are the people that you need to get on your team, and what are their objections going to be? Because it's really important, and we'll talk about that later, but it's very important to be able to put them in a position to say yes. And you don't do that without thinking in advance what would make them say no. So in your be ready phase, it is just figuring out, again, how much it's going to cost, what support you're going to need. If you're working with vendors, IT departments have so many things to consider. It's normal IT departments is stressful enough, but then you put healthcare on top of that, and it's all the regulations and all the acronyms. So it's a ton of stuff to understand in advance before you start your negotiation. So then once you do start, the second R is and that's the being relatable. And that's how can you establish a quick, authentic connection? And that's the key, authentic connection with your counterpart. And that's solely because people help people that they like. So how am I going to do this so they're going to want to work with me? Just, it can be tiniest little things. Sometimes it would be amazing if you get to work with them in person and you get to chit chat beforehand and common ground and where you're from, that kind of stuff. Amazing. But we all know realistically that doesn't happen as much as it used to. So instead it's, being really responsive to someone, because everyone likes it when someone gets back to them with their call or an email quickly, or being respectful of the time constraints and acknowledging their time constraints and following up with them, making sure if you say, I'll get this to you, that I'll follow up. So those are the things that kind of build that authentic connection that really, if you're in a tight negotiation, even if sometimes if you're not, it can just be enough to tip that person, even if they don't know it, to be like, yeah, okay, I'll give them that. I like them. Yeah, that's okay. It's not going to harm me terribly, versus if they don't like you. And then you can get the opposite. Like, you know what? I don't want Chris to win this because I just don't like him.
Right.
And, that can happen too. So that's being relatable. The third part of that is just being reasonable. And being reasonable, first of all, never hear that that's being a doormat and you have to make a deal no matter what. That's not at all what I'm saying. But and if you've ever studied in this field, the first thing you'll see is a lot of hostage negotiators are in this field. And that's because they have the best stories. They're so interesting. I love them too. Fantastic. But I come from a business perspective. And so there's a lot of gray. It's not just a black and white. There's a lot of win area. So again, going back to your being ready, you're going to prioritize in advance. You're going to know exactly what you need for this to be a good deal and what would make it a bad deal. So when in that reasonable phase, that's where you really get creative and really say, okay, where can we connect these two positions, and where can I find a bridge so we can kind of both win and come to a reasonable an acceptable agreement for both of us.
Yeah, and then I know another tenet that you discuss in the book is don't ask, don't get. And Lynn, can you give us a little bit on that mindset? And then Maggie, I'd really like to understand how you see this playing out in hospital systems today. So Lynn, if you could set the deck and kind of give us that context of don't ask, don't get.
Yeah, so the whole concept of that as a mindset is just knowing that people are not going to read your minds. You have to speak up. You have to ask for what you want. So I say you have to make the ask. If you work for me for 30 minutes, you're going to hear don't ask, don't get, and make the ask. It's very consistent because, again, you have to be able to advocate for yourself. And it's not just yourself, but it's for your department. It's for your organizations, your hospital, it's your team. And in terms, too, with IT groups, and Maggie kind of alluded to this earlier, but I think it's so important with the don't ask, don't get mentality and the formula. Again, I just challenge you to not think of this in terms of just using it for external, for vendors and contractors and subcontractors. Look for opportunities internally, like today. How can I use this with the subordinates, with your peers, and managing up? Like, how can I use this formula? And the don't ask, don't get trigger that I always say is in your mind. If you hear I wonder if Maggie would ... whatever it is. I wonder if Chris would consider ... You will start hearing that in your own head, and then that's your trigger. That's to say, you know what? Make the ask. Don't ask, don't get. Let me raise my hand and make the ask.
Yeah, I really like that. And it's so simple on its surface, but that is a really hard thing to do in practice. So Maggie, help us understand how you see that play out in your world in hospitals and healthcare systems.
Sure. And I think, again, going back to the point that I led off with is that a lot of times the people who are negotiating in behalf of the organization are not really comfortable with it. They see negotiation as conflict. And a lot of people hate conflict. Lynn and I are lawyers. We eat conflict for breakfast. We jumped into that, right? But a lot of people are really uncomfortable with conflict. And so they think that asking for something is taboo. And so I think it's really empowering when you start thinking about, just like Lynn said, if you're wondering, then ask. What's the worst thing that somebody can do is tell you no, right? And at some point, now maybe you don't do every single one, but I think you prioritize. Where are the places where I can ask? Where are the places where I can, see where I can get some additional movement or additional opportunity? I think the other thing, though, that I love in Lynn's advice is not. I think a lot of us get uncomfortable with negotiation, uncomfortable with conflict, and then we get uncomfortable with silence. And we feel like we have to keep talking. And when we talk, we give up a lot of our leverage. And so one of the things that Lynn talked about in her book is the silence and a smile. So Lynn, would you mind talking about that for a minute? Because I love that.
Yeah, it's the easiest concept, and I think it's one of the most effective and the littlest practiced, because a lot of times, especially if you haven't prepared, if you haven't spent as much time in your due diligence and you don't know exactly what your priorities are, you'll get in there and you'll kind of panic a little bit and you'll say, okay, well, how about 5,000 off? And you wait just a nanosecond and you don't get an immediate response. We're like, well, I mean, we take 3. Would 2 be okay? Like all you have to do is zip it, just silence and a smile. But you have to know that and in advance and be willing to pull that out as a tool and practice it. Just like the don't ask, don't get mindset. You need to have that and know like it's okay to stop talking and let them respond. And could it get awkward? Sure. I've had it a million times where, I go silent and they just look at me and then we kind of have this smiling contest, but just know, like, have something ready, and be able to say, what do you think about that? What are your thoughts? You need to have some sort of verbal cue to let them know I'm not budging until you respond to what I said. So that's the whole concept of just silence and smile.
I really like that. And you're also incorporating some of those, I'll say sort of open-ended questions, what are your thoughts? What do you think of that? I think that's a really underutilized tool that I've seen in negotiations as well.
Absolutely.
So for my experience with IT leaders is that it's oftentimes very much like a consensus buy or whatever it might be, a consensus decision, let's say. And with that, I've seen a lot of IT leaders struggle to get buy-in from internal stakeholders, external vendors. And I assume that there are going to be nuances when you're talking to each of these sort of individual groups. Can you talk a little bit about the differences that you see in negotiating with maybe internal stakeholders versus external vendors? You mentioned sort of up the chain, across the chain, down the chain with subordinates. What are some of the differences that you see depending on the type of group that you're talking to?
So the biggest difference is when you're negotiating internally versus externally. Internally, you've got some street cred. people know you. They know your authenticity. They know when you push. They know when you fight for something that you really mean it. So you've already got a little bit of leverage there. And that's really important, because if people know you're authentic and they know some of your history, I think they understand that you're likely to really push for things that you believe in, or to be honest with them, to say, I don't know that this is something we really should throw all our weight behind. I think you can use that to your advantage when you're negotiating externally, because they don't know you, right? So it's kind of an unknown commodity, or they don't know how badly you really want this product.
Right.
So, or how badly you need it. And I think one of the other things from an inside healthcare perspective, that to always keep in mind is healthcare is so complex because it is so highly regulated. So not only can I can't just negotiate with an outside IT vendor. I have to be thinking about what's my regulatory and compliance folks going to think about it. What are my clinical stakeholders going to think about this? What about finance? Can we bill for this? In addition to just the cost, IT security. There is so much, healthcare is so complicated that I think it makes some of the regular negotiations you might have in other industries just exponentially more complicated, because each one of those people are stakeholders who are going to have an opinion about negotiating this contract. And so it requires a lot of diplomacy. When you work in the healthcare IT space, I'd say any healthcare space requires a lot of diplomacy, because there are so many different stakeholders, and because healthcare IT may not know about every regulatory hoop. So you have to rely on the subject matter expertise of all of the people in your organization to make sure that you're making a decision, which is great. You don't have to be an expert in everything, but then you also have to bring along a lot of other people with you as you're having these negotiations. So you're not as nimble or as agile as you might always want to be.
Anything to add to that, Lynn?
Yeah, no, I agree with what Maggie said. I'd also add, I think that being nimble, but also being probably more patient than you think you should be. Because I used to manage the legal department of a national engineering firm, and I can tell you, I know very little about IT. So we could be in a meeting and we're fighting for resources, or funding or something. And the most successful people in that role were really truly educating the people in the room. This is why this is a big deal. And from legal too, like, people don't love financing legal programs all the time. So I had to do the same thing. And sometimes, especially this is another form of negotiation, sometimes it means lobbying before those meetings and going to Maggie and saying, here, I'm going to talk about this. Here's why it's important. Do you have any questions before the meeting? So you can kind of see what the strengths and what the areas that people are concerned about, so you can kind of get to the heart of the matter quickly. Because again, time is of the essence when you're in a meeting with healthcare executives. And if you're the IT person with the most complex thing, you got to be able to know how to just be quick and give them what they know, and then stop talking and let them make a decision.
That's so important. And especially, I love, Maggie, how you sort of related that back to, again, going back to that consensus mentality in healthcare. I think that seems to be something that's really unique, where, in a lot of other, instances and deals and projects and so on and so forth, there's kind of, one or a couple of central decision makers. Whereas in healthcare, there could be, 15 or 20 people, maybe even more, if you're talking about really complex IT systems. I can only imagine, how many folks at BJC were involved in, the Epic project, both internally and kind of externally with Epic. So is that fair to say that that's pretty unique to healthcare? Are there other industries that mirror that?
I haven't worked in that many between law and healthcare. I haven't worked in that many other ones. But when you look at how highly regulated healthcare is, and the reason it's so highly regulated is because of the money, right? I mean, so there is huge areas for abuse, there is huge areas for waste, and so there is a lot of people who have their fingers in the pie of healthcare, whether it's and then when you think about federal regulation, state regulation, agency regulation, there are so many people who have interest in making sure that healthcare runs smoothly and efficiently. And I'm glad they do, right? That's what keeps us all safe every day. I don't mind that partnership, because I think it's there and it's designed to make sure that we are providing really important service in a very safe and efficient, and hopefully at some point cost-effective manner. But I do think it's unique to healthcare. And I think that's one of the things that I've seen, coming from private practice into the healthcare setting. We didn't have consensus in the law firm. It was, we didn't sit around and ask other people how they felt about making decisions. And so I like this. This is an environment. Healthcare is an environment, again, as long as you know what you're getting into. It can be slower, it can be a little tedious, but what you'll find in a highly functioning healthcare system is that everybody's rowing in the same direction. We all want the same thing. But yeah, whether it's a decision about what your electronic medical record platform is going to be, which is a huge a huge undertaking, or it could be something as small as, are we going to start doing ambient listening and note taking in our ambulatory space?
Right.
And so, it's big decisions, little decisions, and, all kinds of, are we going to use smartphones for secure messaging or secure chat? There are all kinds of levels of decisions. And some of them you can make, you've got some authority to make decisions at that local level, but other ones you need to recognize that this is something, if you want it to stick, that you need to get buy-in from a broader group. And most healthcare organizations that are sophisticated have a process for tackling these really complicated challenges and questions, and it's exciting because, like I said, it is coming at us so fast. The changes and the technology enhancements and the advancements and what we can do, that this is going to be fun to see where we go for the next 10, 15 years.
Yeah, absolutely. And I know one of the challenges that we always run into is, budget constraints, especially in healthcare, where we're faced with challenges on both kind of the revenue side. We're faced with challenges on the cost side. Healthcare is a tough environment to operate in historically, and certainly these days when it comes to budget constraints. So Lynn, I know you go through a couple of really nice strategies for balancing must-haves versus nice-to-haves in your book and in your research. Can you talk to us a little bit about that and how that fits into the negotiation process?
Yeah, so I basically kind of put everything that I want to ask, all of my asks, from the don't ask, don't get, making the ask, I put them all into 3 buckets, basically. Because if you just come in and say, this is what I have to have, and you have no room for maneuvering, like that's not a negotiation. That's just kind of blackmail, or that's just a demand, right? You don't want to do that. You need to prioritize your ask. So the first bucket are your have to haves. So those are the most important things. You truly have to have those in order for it to make a good deal. Like if you don't get one of those, this would not be a good deal for me, so I need to walk. The key to those is keep them as short as possible, because you truly, truly will walk if you don't get your have-to-haves. So the second bucket are the helpful haves. These I think a majority of the changes will go in there. They're things that ultimately will help your position in whatever you're negotiating. One way or the other, they're going to help you, and you're going to be the most creative in this zone. And so it's going to be it's almost like a choose your own adventure book. Like, okay, if I don't get something here over here in this chapter, can I get this? Okay, if not, then I do want that. It's back and forth. It's really seeing how the thread connects everything. So you're going to do your most negotiation there. Then the third one, those are your hopeful haves. So these are the things like, yeah, they'd be nice, but I'm not going to lose sleep. My CEO is not going to notice if this is not in the contract. So you want those in there, because ideally the best kind of negotiation is where the things you care about the least are the things your vendor or whoever cares about the most, right? Because then everyone is super happy. So you need to have some things in there. But the only thing I would advise with the hopeful haves are make sure there's a reason. Don't throw something in there and not be able to justify it. Even if you don't love the justification, have some reason that it is there and that you're asking for that change.
It's really interesting. And you touched on sort of the nature of any negotiation is always going to involve a little bit of kind of horse trading, a little bit of quid pro quo. I'll do this if you can kind of think about that over here. And you think in terms of, I'll say the process, that's something that you try to lay out ahead of time in terms of, I have these nice to haves, but these are the things that are really important. And these are some potential sort of trades that I might be willing to make to get to an end objective. So you advocate for laying those things out sort of ahead of time, correct?
I do. If you can predict, kind of where it's going to head, like you have no idea. You don't want to just show your cards all at once. But if you can say, if you know for sure that this is like you've negotiated this multiple times, or for whatever topic it is, this is going to be a concern, don't act like you don't. You can say, okay, Chris, I know that the pricing for this project is going to be a concern, so I've considered these things to make it more palatable for you. What are your thoughts? Frankly, it speeds up the negotiation if you can recognize, like, hey, I know that this is an issue for you. Let's just get right to it and get the important stuff out of the way. Because again, for them, that probably is a have to have. So if you can't agree on that, you might be wasting your time on the negotiation at all. So, but the whole concept there is, I like to, again, I mentioned earlier, is like to put people in a position to say yes. So if I can project or predict what is holding you back, what can I say in advance to get you there so that everyone can move forward a little bit quicker?
And I love that notion of trying to make it easy to say yes. And obviously, again, IT contracts, healthcare, this is an interesting environment that we all operate in. How do you position that argument so that decision makers can easily say yes? What does that look like?
Well, I think the first thing you need to look at is like, who is your initial audience, right? Because if it's the healthcare executives, if you need to say them, again, this comes back to the education part and the being ready, like knowing what they don't know. If you can come to them and say, hey, if we don't do this, we are looking at a catastrophic failure. If we don't do this, there's a risk of a data breach, or we can't have a long-term lock-in with this vendor because of XYZ, because things are changing so quickly. So it's just kind of knowing and tailoring your response and your education piece to whoever you're talking to. Same with the vendors. If you can say, like, again, for that long-term, kind of lock-in, like, hey, we are not in a position to do that. We can work with you short-term and we can see if this works for us. But it's just, again, trying to think like, what are their hesitations and how can I address those quickly?
That's a really good perspective. And I guess, Maggie, I'm curious in your experience specifically with your lens in health systems and hospitals, is that something that you find that health systems are kind of open with in terms of that vendor negotiation? What's important to us? What's important to you guys? How are we doing on that, I guess, in terms of negotiations between hospital systems and vendors? Is that pretty open and honest today, or is there still some work to do there?
I would say it. So you go to law school, and when you graduate from law school, the only thing you know is the answer to every question is it depends, right? So this is where I'm going to throw out my old it depends. It really depends on the service line. It depends on the vendor. It depends on the time of year. It depends on the supply chain. I mean, there are so many variables of what's happening with us in healthcare right now, and things that you used to be able to depend on to be rock solid. You have a flood at a distribution facility in North Carolina, a once in a lifetime flood, and what you thought was a rock solid relationship may soften. And so I think, again, it comes back to being able to be nimble. So I think we learned through the pandemic that nothing was a given, and that we needed to be able to be much more adaptable and flexible. And I think we've seen that. And I think that's been great. So whether it's been, drug shortages that started years ago, and on the internal side, then it's making sure that we have the ability to be flexible to adapt to what's being thrown at us. And so sometimes you may not be able to negotiate if you've had a critical supply chain shortage. If a manufacturer of contrast has a factory that's shut down in India, all of a sudden, that relationship with that vendor, your exclusive agreement, you may need to be looking to somebody else. So I think it really has impacted the way that we have tried to diversify, and that has put some strain, I would say, on some of the relationships that we have with outside vendors. But it's also opened up new opportunities with vendors that we hadn't looked at before. So, and again, it's just a good business practice in not putting all of our eggs in one proverbial basket. I think one of the things, though, that Lynn talks about a lot is about being prepared. And I cannot stress the importance of being prepared. The negotiations that I have gone into internally within my organization or externally with a patient or an outside caregiver where I was prepared went exponentially better than when I wasn't. And I even had an experience last week where I picked up the phone and called a patient, and I was in a hurry to get it done, and I wasn't prepared. And it probably started step 2 where we could have started at step 8 because I was not as prepared as I could have been. So I think being prepared is really important. And one of the things that Lynn emphasizes is actually practicing it, saying it out loud. That's something I think we all know we should do, but we don't. And I think the importance of practice, if you aren't sure you're going to be able to say this in a meeting with actual executives, if you can't say it in your office with the door closed or to the mirror yourself, there is no way you're going to be able to have that conversation. So Lynn, I don't know if you have anything you would add about practice.
Yeah, no, I just think it's such an important step. And when I was training attorneys back in the day, and they would study the agreeable terms, and not hard, and they're fresh out of law school, they know it. And then I'd say, hey, so I'd put my, client hat on and be like, what about this? What about that? And they just panic because they just hadn't articulated it yet. And there's just such a big difference. So yeah, if it's your mirror, if it's your dog, my dogs are expert negotiators now. They don't know it yet, but I've talked to them a lot about it. Someone this weekend, we were talking, and they even suggested using AI for this and putting your argument in and speaking it out and saying, here's my argument, where are the holes? And I think that's, an interesting way to use AI. And again, it's just not being afraid to say what you want, and then being humble enough to know I need to practice the skill before I say it. And this is at all levels. And I consult with a lot of different groups, and I consult with a lot of different companies that are as heavily regulated, a lot of utility companies, engineering companies, not as much as healthcare, but their utilities are pretty up there. Sure. And it's so interesting because, yeah, to Maggie's point earlier, you can be a subject matter expert and you can be incredibly good at your job and still not be a great negotiator. And there's no reason to be embarrassed about that. And it's a very easy thing to fix if you just kind of open yourself up and think, just first of all, be open to the idea, I can get better at this, because it 100% is a muscle. And people who tell you it's not, and I was born with it, they definitely are trying to sell you something. Do not listen to them. This is a muscle that can't be built. I promise, I've seen it. I've done it hundreds of times with people. So don't let that get in your way, and definitely practice out loud.
I think it's so underrated. And you touch on this in your book, Lynn, just in terms of, getting over the fear in a lot of ways where, even really intelligent, smart, we can communicate, during, I'll say, normal circumstances, normal conversations. But when it becomes a negotiation, there's that, almost emotional element. And then there's, of course, a little bit of that fear that sometimes people have to get over. And it seems like, preparation is one of the ways to kind of conquer that, I guess.
Yeah. And I would say, listen, I've done well over 11,000 at this point. And there's still things, if it's not subject matter expert, that I have the most knowledge in, I still can get intimidated and fearful. But, I've trained myself enough to when I have that don't ask, don't get, hey, I wonder if, I know if I don't ask, I will regret it later. And that to me is a worse feeling, the regret of not asking and wondering if I would have gotten something versus I asked and they said no, or I asked and they said no rudely. Oh no, that's fine. Who cares? The point is you asked, and I feel so much worse if I have regret over not doing it. The one thing you did say, emotion, that I will want to throw out there, because I think this is helpful, like no matter where you are in an organization, is managing your emotions, because sometimes these negotiations can get emotional, they can get stressful. And my only advice there is twofold. One of them is, when you're using emotions, if you want to show stress, and I'm all for it, like don't be a robot. You can show stress, you can show anger, you can show disappointment, just make sure you're doing it intentionally and not reactively. Make sure you're aware, I'm going to raise my voice right now, or I'm going to do my, are you kidding look to Maggie right now? Because I want her to see this, I want her to read my nonverbals, but make sure it's not an unintentional, oh, I forgot my camera was on. I'm like, oh my God, what? Like, no one wants that. So make sure it's intentional, not reactional. And then also, I'm a big advocate of not, of waiting until you cool down. If you truly are really in the heat of the moment, like don't say anything in true anger. And that's what I talk about in my book. And that's the reminder of, if it feels good to say it, don't. Because if it's going to feel good to say it, you are drawing from a well of anger and emotion, and it is not going to improve your situation. I know it's going to feel good. I promise it will be more effective later if you don't say it now and you come back and address it at a later time.
And Lynn, that's a good segue into your CEO rule.
Yeah. So my CEO rule is this: if it's written or spoken or anything really, if what you said or wrote, if the CEO heard it or read it, are they going to be proud of you and be like, yeah, you get him, or great job? Are they going to be indifferent and couldn't care less? Or are you going to get fired? Like that should be a filter you're using for, is this a good idea to put in writing? And this is the lawyer hat coming, right? Because it's all discoverable, but even when you're speaking to someone, if this gets back to them, are they going to say it's okay and good job? Is it indifferent, or am I going to get fired?
Yeah, that don't press send right away mentality, I think is
Right.
really good words to live by. That's for sure. And I love that analogy. If you can't say it to the CEO, what would the CEO's reaction be? That's a wonderful barometer. That frankly, I wish I knew a little bit earlier in my career. In some examples, you make those mistakes a couple of times, and you learn pretty quickly, though.
There's a reason you learn this and put it in a book. It's because you didn't learn it and didn't do it for a while.
That's exactly right. This has been an awesome conversation. Maggie, I'd love to turn it over to you for any final thoughts, or if there's anything that you're working on, excited about, that you want to share with the community. So Maggie, we'll turn it over to you first.
Yeah, so I think what Lynn and I have uncovered in our discussion about her book is that there is a real need for people to feel more confident in to learn how to exercise that muscle. And so far we've had the opportunity. I think people are realizing that that's an opportunity. So we spoke to the American Society of Healthcare Risk Managers at their annual conference. We've been invited to speak in a couple other venues, this great format, to be able to share some of this expertise. So I'm just really excited that there is an opportunity for us to share some of this expertise, because again, I think it makes us all better when we know how to negotiate confidently. I will tell you, a lot of these tips and tricks I apply in my personal life. So it's not just, negotiating in my professional setting, but there have been times that these lessons have come in very handy with my children, with my spouse, with my neighbors. So they're just really good life lessons, and we're really happy to be able to share them with people.
Yeah, I completely agree. And Lynn, any closing thoughts from you? And I'd also like to make sure that you tell our audience where they can find out more about your work and also pick up a copy of your book.
Yeah, absolutely. My book's on Amazon, Barnes and Noble, like all the
Just like
biggies.
all the
It's pretty
places that
easy
you
to
find books, right?
It's exactly where books are. You can find the book. It's again called Negotiate It. Also on my website's Lynn Price Consulting. And honestly, on LinkedIn I love connecting with people. Like this is something like I truly love talking about negotiation. And so I do a lot of consulting with people on one-on-one, but then also I work with a lot with businesses. I come in and do for seminars and presentations and do a lot of small groups too, because it's not just the presentation on my book, but it's like, okay, that was all fun and games. Now here are some scenarios I just wrote based on your organization. And now we're going to go through them and see how you apply it. And that's basically, it's the same thing as practicing it out loud, right? And it's so fun to see people go from like, yeah, I got it to, how are we going to do this? But when they leave, they are so much more comfortable and know, hey, I know when this happens again, and it will, because these are common scenarios, that this is how I'm going to tackle it. So I do a lot of that. And then hopefully within the next, 4 weeks or so, I'm releasing the Audible version, because I realize like most of us are listening to books a lot more than we're tangibly picking them up and reading them. So that will be available soon as well.
It's fantastic. This was a really wonderful conversation. Thank you so much for joining us today, Maggie and Lynn. It was really great to have you on.
Thanks.
Thank you so much, Chris.
And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little bit more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's our show for today. And until next time, this is Chris Civitarice wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.
Informed consent is vital to patient care, but how can you help patients make informed decisions? Introducing iMed Health from Taylor Healthcare, digital tools that standardize and simplify the informed consent process. Go to imedhealth.com to learn more. Find the link in the show notes.